All right. Okay. So good morning, good afternoon, or good evening, and welcome to our annual learning lab on the HIV estimates. My name is Isabella Brazzolini, and I'm an intern working with Brigade Kierkegaard and Knowledge Management within the HIV and AIDS section in the Health Programs Group. And I'll be hosting the session today together with two colleagues from the Data and Analytics Division, Chiboy Lwamba, who is a statistics specialist for HIV, and Savi Brar, who's the statistics officer for HIV. And first, I'd just like to briefly run a show for today's session. So we're going to start by hearing some opening remarks from Maria Muniz, who is Senior Advisor for Statistics and Monitoring. And then Chiboy and Savi will present the latest UNAIDS 2024 estimates for HIV in children, and they will discuss the regional and global HIV trends, coverage rates, as well as present data tools and resources developed specifically for UNICEF staff to use. The presentation will take around 40 minutes, followed by 10 minutes of Q&A. And finally, Annie Rita Bings, UNICEF's Associate Director for HIV and AIDS, will wrap up the meeting with some closing remarks. And she'll only be able to join us mid-session, so is being currently represented by Senior Advisor Mary Gwynn Delaney. And before we actually get started, I would like to go through a few housekeeping rules. Just make sure you see my screen. Okay, do you see it? Great. So please remember to keep your mics muted. If you have any technical issues, please send us a message via the chat box, and we're going to try to help you as soon as possible. If you have any general comments or questions for the speakers, you can send them at any time through the chat box, but we'll only be taking them during the Q&A after the two presentations are done. And you can also raise your hand using the reactions buttons and then ask your question live instead. The webinar is being recorded, and the recording and PowerPoint slides will be made available on SharePoint afterwards, and I'm going to share the link via email with all of you. And now, without further ado, I would like to hand over the mic to Maria Muniz.
Hello, everyone, and thank you so much for joining today's 2024 HIV Estimates Learning Lab. At DAPM, we work hand in hand with the HIV Program Division, and through our collaboration, we ensure that data insights are translated into action on the ground, and that data informs decision-making at every level, from high policy setting to community-level interventions. The intersection of accurate data with targeted programs allow us to respond to gaps in treatment, particularly for children and adolescents. As a co-sponsor of the Joint Program on HIV/AIDS, UNICEF plays a critical role in contributing data to the global HIV response. We work very closely with UNAIDS, WHO, and governments to analyze, gather, and apply data to drive effective programming. And this partnership provides us with a wealth of data critical to achieving our shared goal of ending HIV/AIDS by 2030. And the latest estimates that we share today, they're not just figures, they are the foundation upon which we build our strategies for treatment, prevention, and support. And so today, led by Chiboy and Savi, we'll be showing that despite a significant reduction in new infections among children, adolescent girls in sub-Saharan Africa remain disproportionately affected. We'll also be exploring I'm back online. I'll turn my camera off in the case of bandwidth, and hopefully you can hear me. Can you put a thumbs up if you can hear me again? Great, thank you. So as I was sharing, we'll be exploring how the 95-95 targets are being met differently across age groups and regions. While there have been strides in pediatric HIV response, adolescents are often left behind. Data from today's session will underscore it's critical that we accelerate efforts to ensure all young people living with HIV are connected to life-saving treatment. And it's critical that we intensify our efforts, particularly as we move towards the 2030 targets. While we've made progress, there's still a long road ahead to reach the goals. And so this is really an important opportunity for us as part of this learning lab to reflect on where we are and, more importantly, what we need to do to close the gaps in treatment and prevention for children, adolescents, and pregnant women globally, with a strong focus on tailoring our interventions to reach the most affected and vulnerable populations. So I really encourage you, as you see the information presented today, how we can help innovate and refine our approaches, and together linking data with programs, how we can drive impactful change on the HIV response. I'm really looking forward to the discussions that will follow the presentations, and I really encourage everyone to use the time to exchange ideas and learn from one another. Thank you very much. Back over to Isabella.
Thank you, Maria, and I'll just directly hand it over to Chiboy and Sabi.
Thank you, colleagues. Good morning, good afternoon, good evening from wherever you are. And today we are really presenting the new data on children, adolescents, and pregnant women. So we'll try as much as possible to break it down. So myself, Chibwe, and Savi. So the outline of our presentation is we'll do first the global burden of HIV, and we'll go into 4 different thematic areas: the vertical transmission of HIV, which we normally call PMTCT, the pediatric treatment, adolescent treatment, and adolescent prevention. And then we'll give you some of the takeaways and probably next steps. Yeah. So as we may know that, the burden of HIV, sub-Saharan Africa normally takes the greatest hit in terms of being home to over 80% of children living with HIV. So the burden of HIV is mostly in sub-Saharan Africa, and though most of the strides have been made in the response, children and adolescents still remain affected by the epidemic. Next, Stephanie. And we've seen that, since 2010, new infections have dropped by 62% among children aged 0 to 14. And why since 2010? That's a political declaration. That's a baseline. And if you go by regions, Eastern and Southern Africa region was about 72% reduction. South Asia, 68%. ICAR, 44%. West Africa and West and Central Africa, 44%. LAC, 36% reduction. IAPRO, 28% reduction, and 35% increase in MENA. So the only region that showed an increase is MENA, but we need to take this into context, looking at the size of the epidemic. Currently, in ISA, we have about over 800,000 new infections every year. South Asia, about 71,000 infections every year. ICAR, about 16,000 infections every year. West and Central Africa, about over 370,000 new infections every year. LAC, about 40,000 every year. IAPRO, 46,000, and MENA, about 5,000 every year. So if you look at that, variation by region, we see that, the burden, like we shared in the map earlier on, is mostly from sub-Saharan Africa. Next. Similarly, from the AIDS-related deaths, we've seen significant reduction from the peak in 2000, from 2002 to now. So we've made, significant progress. So we'll be able to also show that, globally, there's been about 79% reduction in global AIDS-related deaths. Globally, about 76,000 AIDS-related deaths, and South Asia registered the largest reduction of about 90%, followed by East and Southern Africa, 86%, West and Central Africa, 61%, LAC, about 60%, ICAR, 44%, IAPRO, 48% reduction, MENA showing 500%, 50% increase. But again, we have to look at this into context. So the size of the AIDS-related deaths in South Asia currently stands at 2,000 annually. In East and Southern Africa, about 32,000 annually. West and Central Africa, 32,000 annually. And LAC, about 3,000 annually. ICAR, less than 1,000 annually. IAPRO, about 4,000 deaths, child-related deaths annually. And MENA, less than 500. So when we're looking at these two indicators, I think it's important to look at the relative compared to the absolute numbers. Next. Yeah, again, if you look at all the adolescents of 15 to 19 years, there's been about 48% reduction since 2010. Like I said, we need to look at into context of, the size and relative in terms of the variation we're seeing by region. But, by age as well, we see more infections actually happening more in, reduction in the children because of the vertical transmission programs that are taking more effect. So, and we are still far from reaching the target of 90% reduction from the 2010 baseline. So we're still far from reaching that. So next. Okay, this one shows age-related deaths among adolescents again, 15 to 19. We've seen at least, just about a quarter reduction since 2010. You know, less than 20,000 deaths there every year. So it's been more almost steady there. We haven't seen so much of a reduction compared to children less than 15 years. So we need to do much more. Next. And HIV, we know that it's a leading cause of death among adolescents and young people in sub-Saharan Africa. Yeah, now we move to vertical transmission and commonly known as also PMTCT. There are about, 1.2 million pregnant women living with HIV. Out of that, we have about 84% accessing treatment. And, the global target by 2030 is 95. So we're about 1 million people we are reaching, pregnant women. So we need to close in the gap for that. So the transmission rate is about 10%. And annually, we see about 120,000 new infections for children, So again, the target is to have less than 50,000 annual infections for children born from pregnant women living with HIV. And comparing by region, we see that, that this is PMTCT coverage. Eastern and Southern Africa is the only region so far to have shown sustained progress in preventing mother-child transmission. Other regions are remaining behind. So you see the green bar on top there, that's the East and Southern Africa. The dotted black, that's the global, and the various regions below. So, but if you look at the blue bar, for instance, for EAPRO, it shows a spike after 2020. That is post-COVID. It's quite accelerated progress. So maybe, we'll need to learn much more what's happening in EAPRO. But we see that, the coverage right now is standing at 84% at the end of 2023 for globally. And, those are the regional variations, we're seeing that, and we're saying also ISA has the highest coverage of about 95%, and MENA at the lowest at 3%, followed by South Asia, about just over 50%, 52%, and 70% of all pregnant women living with HIV, like we said, is in ISA, and an additional 20% in West and Central Africa. So if you add the two, 90% of all women living with HIV live in Sub-Saharan Africa. Next. Yeah, but I think we have to celebrate also about our achievements, in terms of implementation of these programs. What we've seen since the start of the PMTCT or vertical transmission program, we've seen that the ART and antiretroviral treatment and cotrimoxazole treatment have had an effect in terms of reducing new infections and deaths. We've found since the start of this PMTCT program, we've averted or prevented about 4 million children getting infected globally, and also about 2.1 million children dying of preventable diseases, age-related deaths, So this is starting from early 2000, that's when most of the PMTCT programs were rolled out. So we start measuring since 2000. So this is where we do the cumulative. So we can also do variations by regions. So next. And this is the stack bar. We compare infections between pregnancy and breastfeeding. And we still have a lot more, much more work to be done. And we say that 120,000 infections occur every year, and mostly from, during pregnancy. As we can see, the longer bar is most of the infections occurring. And it's because of most mothers are not on treatment. And out of the 50,000 infections that occur during breastfeeding, about one-fifth are due to maternal incident infections. So meaning, the pregnant women being infected during pregnancy. So we need to prevent that. So we need to do a lot more testing there. And about a quarter of all pregnant women living with HIV are aged between 15 and 24. These are adolescents and young people. So we'll be able to see also by region. So next. So this is the regional variation that we're saying for the comparison of pregnant women and mothers living with HIV. We see that globally about a quarter of all pregnant women are adolescents and young people, and then by various regions, you can check for yourself that the lowest there is for Eastern Europe and Central Asia. And I should have mentioned this year we are lucky that we have at least data for Eastern Europe and Central Asia. It's a big, big, big change. So thank you for all of you for the advocacy that's happening at country level and regional level. Thank you. So yeah, so those are the variations, comparison between the young people and the general population for women aged 25 years and older. Next. So when you look at moving on to antiretroviral treatment among children aged 0 to 14, so about 1.37 million children living with HIV, and about 57% of them accessing treatment. And what does this translate to in terms of absolute numbers? It's slightly over, 800,000 kids accessing treatment. So we still have a big gap of accessing treatment. So we'll be able to see by region the next slide. Next slide. So, like I said earlier on, in 2023, end of 2023, it's about almost 2 out of 3 children were accessing treatment that were living with HIV, and there's been a 40% increase, percentage points increase since 2010. In the early years, it was very difficult to access treatment, and the availability of available regimen for children was not as much as it is now. So we see, that in South Asia, we have coverage of PIDs about 93%, followed by Eastern Europe, no, yes, 73%, then SRO, about 65%, and you can see MENA 58, and East Asia and Pacific in 48%, LACRO 38, and the last one is West and Central Africa for 35%. So there's so much considerable progress that needs to be undertaken. And, just keep remembering 2010 is our baseline. It's a political declaration where all countries came together and agreed on the targets that need to be reached. Next. So we talk a lot about the cascade 95, 95, 95. So 95% of the first 95 is that the knowledge of status. Second is access to treatment. And third is viral suppression, So we see that, across all the 3 streams there, the indicators, there's a lagging, children lagging behind, left behind, about between 20 and 25 percentage points difference. So whereas knowledge of status for children, it's about 66% in children, adults 87%, we see there's about 21 percentage points difference. For those on ART 57 and 77, we see that there's 20 percentage points difference. For virus suppression, less than half of the children are virally suppressed compared to adults, about 73%. It's about 25 percentage points difference. So we still have a lot of catching up for children compared to adults. Next. And these, I won't go through all of them, but these are global regional variations. And we see that there's a considerable variation, and in all the regions, the children are left behind. So these are for the children. The 95-95 cascade, the next one. And that's for the adults. So you'll be able to see all these that in all the regions, actually, the children remain behind. The adults are doing better than the children. Next. So when you look at ART treatment among adolescents and young people, there are about 3.1 million adolescents and young people living with HIV, and out of that, about 61% accessing treatment. That's about 1.8 million of them, and we're still very far from the target of 95%. We have, there are less than 6 years remaining, to reach 2030. So we need to really accelerate the progress for this. Next. And these are the regional comparisons of variations. And like we said earlier on, efforts need to be ramped up to link adolescents living with HIV to life-saving treatment, regardless of sex. So we see for globally, for adolescent girls, young girls and young women, age 15 to 24, it's about 65% there. And for boys, 56%. In SR, there is no difference. Both is 68. Whereas in MENA, it's context specific again. We see that it's the only region actually there are more boys accessing treatment compared to girls, 28 compared to 43. Whereas in Western Central Africa, there's not so much variation, 66 and 61. LAC, again, 47 and 40 there. And East Asian, South and Pacific, 41, 36. So we have to learn more about what's happening in MENA in terms of access to treatment. So next. And then we're trying to see the disparities between, HIV in adolescents by region. We see that globally, adolescent girls accounted for about 2/3 of all new HIV infections among adolescents. That is 70% of infections occur globally among girls compared to boys, 30%. And, in Sub-Saharan Africa, it's almost 6 times as many adolescent girls were newly infected than adolescent boys. So in East Asia, South Asia, and LAC, there are more boys newly infected with HIV each year than girls. So, and that's, if you look at the 3 bars at the bottom there, so that's the ones we're referring to, as the picture changes. Whereas, in Sub-Saharan Africa, like we said, has the highest burden of HIV with 34% of adolescents newly infected with HIV living outside of the region. So, yeah, so HIV is mostly, impacting Sub-Saharan Africa, as we mentioned earlier on. So you'll be able to see most of these slides when you have access to them and internalize it. So, yeah. So what are the takeaways from what we've mentioned so far? Is that Sub-Saharan Africa bears the largest share of the new HIV epidemic in children. And in 2023, we know that Sub-Saharan Africa accounted for nearly 2/3 of all people of all ages living with HIV and 84% of children and adolescents living with HIV worldwide. Savi will be able to demonstrate to us on how you can check on the dashboards on some of these statistics we are mentioning here. And we've seen that East and Southern Africa has made significant progress and is on the path to meeting the 2030 targets in reducing new infections, maintaining ART coverage, but not in pediatric or adolescent treatment. So we need to celebrate, but also put more focus on other areas that we're lagging behind. And we've seen that although significant reduction in HIV infection has been greater in children under 15, is about 62% reduction we've seen. It has not been the same achievement for older adolescents aged 15 to 19, as we saw. It's about less than half of the infections have been reduced in in adolescents and among young people 15 to 24. Next. And with an estimated 90,000 children and adolescents who died from AIDS-related causes in 2023, we see that 73% of all these children, with almost 6,000 plus of these preventable deaths, occurred among children under the age of 10. So when you disaggregate by various age groups, 0 to 4, 5 to 9, 10 to 14, we see that most of these deaths occurred under the age of less than 10 years. And annual deaths among children, although they've declined by 80% since its peak in Sub-Saharan Africa, we need to celebrate. I mean, it's a big reduction, and however, this progress has not been the same for all the adolescents, 15 to 19 years, and HIV still remains as one of the leading causes of death in Sub-Saharan Africa. With the availability of treatment, we need to really ramp up most of our efforts collectively. And we see that more HIV infections occur among female adolescents aged 15 to 19, and a quarter of all mothers needing PMTCT to prevent vertical transmission of HIV are adolescent girls and young women aged 15 to 24. So we need, to design targeted programs for adolescents and young women compared to the older women in terms of the vertical transmission of HIV. So these are the key highlights. Thank you. So I'll hand over to Savi, who will demonstrate to us, some of these statistics you can easily access from the dashboards. Over to you, Savi.
Thanks, Chibwe. Just wanted to confirm, can everyone see my screen?
Yeah.
Okay, perfect.
Yes.
Okay. Hi, everyone. So nice to see you. Good morning, good afternoon, good evening. So before I kind of get started on the dashboard demonstration, I just wanted to highlight that this year we're very excited that we have adolescent treatment coverage data. So UNICEF took the lead in analyzing that data with UNAIDS as well. And we were given the go-ahead, the green light from UNAIDS to actually report and publish that data. So you'll see that on the dashboard that I'll be showing. Chibwe showed a global perspective. I'll now be showing you the regional as well as the country. So in order to access the dashboards, you're seeing here, I'm on data.unicef.org. This is where we house everything data related. So you go here to the resources tab and you can see interactive data visualization. So not just for HIV, but for other health areas as well, you're able to access all dashboards here. On the left-hand side, then you have the resource topic. So I'm going to go to HIV. And then you see here the HIV estimates for children dashboard at the country level. And then if you go a little bit below, it's the HIV estimates for children at the global and regional level. So I have both of them open. I'll go through the global regional first, and then I will go through the country after that. Just to note that we completely overhauled our dashboards this year. It was a labor of love, and we took a lot of feedback into account from previous years, what worked, what didn't work, as well as if you remember those Excel-based dashboards, we utilized the visuals that we had within there and applied them into a more dynamic dashboard. So this empowers you not only as UNICEF staff, but also to share with community organizations, with governments, for them to also be able to access this data. This is all public facing now, whereas previously the Excel dashboards were only for internal UNICEF staff. So now this is for public consumption, public use. And if you have any more feedback, please do share it. This is, not just a once-off production of the dashboard. We're always wanting to improve it for people who are going to be using it and for programming. So at the global regional level here, I'm just going to show you that we have 4 different pages. So at the top is where you could select your region. So I have Africa selected, but these are the reporting regions. You have global. We've also added a global alliance tab. We know that's very important for colleagues who want to look at, how global alliance countries are performing. Humanitarian as well. We know this is also very important for a lot of colleagues who want to look at more of the humanitarian countries grouped together. So the groupings will change as the humanitarian groupings change, so don't worry about that. And then we also have Sub-Saharan Africa, as well as the program countries, and then the UNICEF SP, this is more for our global colleagues, but the strategic plan HIV priority countries. So I have Africa selected, I'll keep it on there. But here, once again, this adds into more of, oh, sorry, I just reloaded. So you have 3 different options for selecting for filtering. So the first is the year. You can go back to 2010. You can also select by sex, and then by age group. So we have 0 to 9, 0 to 14, 0 to 19, 10 to 19, and 15 to 19. We will also be adding 15 to 24 based off of some feedback that we've already received from the HIV team. So at the top, you have some key epidemiological indicators. So those who are living with HIV, new infections, and AIDS-related deaths. If you hover over this chart, you will actually be able to see that breakdown by age. So those 4 age bands that we normally like to report on and to better understand. You can see here that table with 2023 value, the percentage contribution to all children aged 0 to 19, and then the percentage change since 2000, 2010, and 2022. So Chiboy had reported the AIDS, the new infections and the AIDS-related deaths, and he was saying the percentage change and reduction. And I saw some comments from colleagues asking for those numbers. You're also able to access those numbers here on this dashboard. You'll see that these arrows here are green. That is because there has been sorry, if I just hover over this, you can see that there's a legend right below. So green arrow is a decrease since 2010, red arrow is an increase since 2010, and if it's blank, that means that there's either no change or there's no data for comparison that's available. You also then are able to see these time trends for these 3 main indicators for the 0 to 14, 10 to 19, 15 to 19 age groups. And then down below, we have the incidence and mortality rates. Once again, if you hover over these values, you're able to actually see the values and the confidence intervals. It's very important that when you're showing values, these are estimates. So estimates have confidence intervals. We aren't 100% sure that that is the value. However, we are 95% sure that the value is between the lower and the upper bound. Down below, we have some more of the time trends for different indicators. So here, if you select an indicator, we have these 3. Once again, this page 1, is focusing on epidemiological indicators, epidemiological burden. So we have children living with HIV selected. However, if we go to new infections, this will also change. Just to note that you will notice that in children living with HIV and the annual AIDS-related deaths, we had the 4 H bands. For new HIV infections, it's only the 2. And you'll see this note down below that says new HIV infections are assumed to occur among children under 5 due to mother-to-child transmission and over 14 due to sexual transmission. So that is the reason why we only have those 2 H bands here. You also have that regional perspective then. So we always say, you have the proportions, but it's important to also keep in mind what does that mean for that region with regards to the burden in comparison to other regions. So you can actually take a look here at that, and you can change the age. So if you want to look at adolescents 10 to 14, you can adjust that yourself. However, that being said, say that, okay, we're looking at Africa, but we want to know which countries in Africa. We want to see the distribution by country. You can actually change this here and go to country, and it will show you those countries within that region that you selected up top and the burden within those specific countries within that region. So page 2, once again, you just go up and you can just click page 2. Here we have some of the programmatic related indicators. So up top, you can select either EID coverage or PMTCT coverage. This will show you the trend over time. For PMTCT, it also shows you the MTCT rate. And then here, and if you see these charts and are super users of the Excel-based dashboards, you'll notice these are replicas of those dashboards. So we have the gray is the pregnant women living with HIV, and the purple is the number of pregnant women who are on ART. This seems a little bit busy, but it's because we've selected Africa. If you go to a different region, it definitely becomes less busy, but there are other ways to show this data as well. So we have the PMTCT coverage trends by country. If we select here, we can actually select specific countries. So say we want to select Angola, Botswana, Burkina Faso, it will then show the PMTCT coverage trends by country. So you're able to compare within your region as well. And then down below, we have the stacked bar of MTCT by source. So on the left-hand side, we have the point estimates as well as the lower and upper bounds. And then here we have the dynamic stacked bar for pregnancy and breastfeeding. You can select, there's 3 different indicators that you want to often look at when you're looking at the stacked bar. So we have MTCT rate, we have pregnant women, and then we also have new pediatric HIV infections. So you're able to actually look at the numbers as well as the MTCT rate, as well as the pregnant women and where they are getting infected during which time point. This third page looks at ART coverage. So up top, we have ART coverage time trends for children in the blue, and in the green is adults. We can also look at children versus maternal. And then the right-hand side, we have those numbers. So you're able to look at the absolute numbers and how we're performing. And this is where we're very excited. This is completely new. And we hope that it's going to be extremely useful for colleagues in regions, in countries as they program. So we have ART coverage here. This is shown at regional level, a time trend from 2015 to 2023. You can select here the 0 to 14, 10 to 19, and 15 to 24. And you can actually also select all or boys or girls. So if I select here, it will automatically change. Let's see here. Oh, sorry, yeah, for 0 to 14, there's no assumed gender difference in ART coverage. So there's meant to be comparable proportions for 0 to 14. But if we change to 10 to 19 or 15 to 24, you'll see that node disappears, and so does this chart. It becomes more dynamic, and the data changes between girls, and I'll have it change to boys as well. If you select something here, keep in mind that it will also change these 2 charts down below. So here we have the map of adolescent ART coverage by country. We also have the same data shown in a different visual format over here on the right-hand side. So this is in the bubble format, where the size of the bubbles is the number of children and or adolescents living with HIV, and the color of the bubbles is the ART coverage. So if you have questions or concerns, I know we're just running out of time, so I want to make sure I show you the country dashboard as well, but please do let me know. We've tried to make it as interactive and straightforward as possible, but if there's any issues or there's any troubles as you're accessing it, please do let us know. I'm now going to the country dashboard very quickly. For the most part, it shows all the same data from the global and regional dashboard, just at country level. There are certain times in the regional dashboard where there are regional specific visuals. So as you can imagine, we removed those, so it's just more country specific. So we have Angola here selected. I will go down and select Malawi. You see those same KPIs that we had in the previous dashboard with those same tables and the same arrows. This one looks very similar to the previous dashboard. The only difference is that we don't have that regional country pie chart on the right since we're looking at country level. Page 2, we have that same programmatic data. So we have EID, you can change that to PMTCT coverage. And then we have the stacked bar as well as ART coverage. Here, it's a bit more static, so you can't select the filters like we had in the regional and global. However, you do have the 10 to 14, 15 to 24 values. The last thing that I want to share is on page 3, and then on this dashboard, you'll notice I didn't go to the 4th page. It's just the notes on the data. So I will let you look through those. If you have any questions, where it's coming from, what do some indicators mean? That's where all of that is. And then a highlight is, we know that colleagues don't always have stable internet connection or the ability to play around with these dynamic dashboards online. If that is the case, you'll see here in both dashboards, we have a PDF button up top. If you press that, you can actually download. You can download specific sheets from the dashboard, specific sheets from the workbook, and you can select the scaling as well as the page size. And you download it, and there you go. So that's page 4. I'll just show you. I'm trying to that got downloaded, and you can also select the different pages and download those. So I'm going to stop here. If you have questions, please do let us know. But we hope that that was useful. I'm trying to find the main page. And I'll hand it back over to Isabella.
All right. Thank you so much, Savi and Shiboy, not just for this excellent overview, but all the work you put into this, like the dashboards are beautiful. But now we have around 10 minutes for Q&A. So please feel free to share any comments or questions you might have. There were some questions also in the chat box. A lot of them have been answered. I don't know if Chibwe would like to expand on Alexander's question about how the data is triangulated and how we verify our estimates using the spectral model. I think that could be interesting.
Sure. I mean, like I mentioned, the beauty with the spectrum model, every year countries come together and we all participate, and thanks again to regions and countries for submitting information to us, UNAIDS, for reporting. Without the collective effort, we cannot produce these estimates on an annual basis, so they're updated every year. So we update the program data, which is a routine data. We update with survey data that is available, to update the assumptions. If there's census data, which is the baseline, we update that also for if there are projections, we update that as well. And then we run the models, which also updated based on the global estimates team or the technical group to review the assumptions that have been put there. So each country, over 190 countries, they have the country estimates team that do take lead in these estimates, and they reconcile the data that is reported in the what we call global AIDS monitoring system and the spectrum, so that they reconcile, so that we produce these estimates. Like Savi was mentioning also, when we say 84%, we are 95% sure that the 84% lies between this value, the low value, and the up value. For all the estimates, they have the confidence intervals. So it's a rigorous process, and this has been built over 20 years. The process and the system. So every year we do come together to help countries and update the information. So for those countries that are applying or have been to the path to elimination process, they do understand the importance of having rigorous and updated estimates, spectrum data. Thank you.
Okay, I think in that same vein, Alexander also asked if there are some countries for which you have more doubts about the reliability of data, and also if the estimates are also validated by national authorities.
Yes, they do. And if there is doubts, we normally don't publish. I mean, for a very long time, like in the CAR region, the estimates were never published. And this is the first time after so many years that in CAR region, most of the countries, they are publishing now their estimates. And the confidence is there now. Thanks.
Right. I think Shafiq also asked about adolescent PMTCT data. I don't know if you have any insights about that.
No, we don't have. It's just a proportion of, adolescents and young people now, 25% or 24% globally.
Let me see. Sal is also asking about dissemination for external partners, and I think we're going to try to get it to childrenandaids.org, which is a public website. So I think we're going to have it on both SharePoint and childrenandaids.org, so it can be disseminated with external partners too. Let me see. All right, there's a question by Ruslam saying, regarding the 57% global treatment coverage for children living with HIV, can you provide insights into the main challenges faced by the remaining 43% of children who are not receiving treatment, and what regional variations exist in terms of barriers to access?
I think that's much more to open discussion, I think, with the team here. They'll be able to give insights into what's happening into each region or country specific. So yeah, I'll defer back to the country or regional engagements. And I think there are some questions that are being posed, to the group by Anurita. Thank you.
All right. Okay, we have another question from Shafiq. Saying 25% of all pregnancies globally are if 25% of all pregnancies globally are among adolescents, and if that's what you meant, Chiboy.
Yes, yeah. So even by country, it's available. Because these estimates come from the spectrum file. So each spectrum country file has this estimate. So I think even on we'll be able to see if this is also in the dashboard. I'm not so sure about this one. Is it there, Savi?
It's not on this dashboard. However, we have the regional breakdown. So if you go to data.unicef.org and you go to our HIV resource page, sorry, not the resource page, the data pages.
No,
we
you're
have
talking
that
about
chart
country.
there.
So that's the country.
But country, no, it's not, the proportion of pregnancies is not on there. But we can definitely look at that.
Okay.
And there was also a question by Bettina about the South Asia pediatric treatment coverage rates and if it's considered to be accurate. And Savi said that we need to consider the confidence interval. So I was wondering if you might want to explain that a little bit.
Yeah, I know. This is what I was saying when I was presenting the reductions and for AIDS-related deaths and infections, as well as people living with HIV. Let's look at context also, the size of the epidemic. We might be seeing 90% of what, so we need to look at that as well in terms of accelerating. And when you compare to sub-Saharan Africa, in terms of putting children on treatment. So yeah, and I think the regional colleagues from IAPRA here, they can also tell us what they've done in terms of accelerating, treatment coverage. So, and, the numbers are relatively smaller compared to other regions. So we have to look at that. Savi, do you want to add in?
No, I think you've covered. Yeah, you covered that.
Okay, MG has her hand up, so I think I'm just gonna hand the mic over to her.
Thanks, Isabella. I think I can say it faster than I can type my question. Going back to the first part of the presentation, and we see it a lot in UNAIDS does it as well, using this starting point of 2010 to now, whether there's been progress or stagnation or even declines in a number of these indicators. And I'm wondering, at what point do we start using a shorter time frame to really document our progress? Is it because are we using a 14-year range because the data looks better over that period of time? Or I'm just starting to wonder if the progress was made in 2012 to 2015 or 2022 to 2024. I don't know if you mean my question, but it seems like it would be important for programming in 2024 if we're not considering such a big time frame. Hope that makes sense.
Yes, like I mentioned earlier, that was the baseline for political declaration where all countries came together and agreed on the targets to meet and reach the 2030. So it takes a lot of negotiation. Like right now, we are also looking at the targeting process, where some things we are going to continue, with the current targets that we have. Others we're going to renegotiate again, and also in the country teams or host countries that come to the UN General Assembly, the teams do change a lot. So there's a lot of negotiation that goes on. But yeah, it's these commitments that were made at the 2010 declaration that each country is meeting. Thank you.
Thanks.
Sukari.
Shafiq, your microphone's on.
I think we got 2 other questions from Ruslan. Before we have to hand over the mic to Anurita's final considerations, I think we can take these 2. So regarding the 57%, oh no, sorry, I already read that one. Can you provide specific examples of how targeted data collection has improved HIV treatment outcomes in children in countries with historically low pediatric treatment coverage rate? And what does the latest data suggest about the long-term outcomes for children who receive early HIV diagnosis and treatment compared to those diagnosed later, particularly in terms of viral suppression and overall health?
Yeah, so in terms of EID, early infant diagnosis, we estimate about 67% coverage globally, and we have the regional variations and country also there. We, in the dashboard paper, you'll be able to see that. But I mean, it's also related to the access to treatment. So if a lot of kids are not being tested and very few knowing their status, it will be very difficult to put everyone on treatment and also to monitor them for virus suppression. So, and again, there's a lot of programmatic strategies there, Ruslan, which have been highlighted. So, again, it would be nice to have, separate discussions on some of these strategies, especially when we go into the next strategic plan period. So, it would be nice to delve into those things, in detail and discuss some of those strategies.
I mean, we have 5 minutes left, so if anyone thinks of any other questions, please feel free to send us emails and we'll get back to you. But now I'd like to give the floor over to Anurita for her final considerations to us all.
Thank you so much, Isabella. And hi, good morning, afternoon, evening, colleagues. Great to see you. Apologies for being late. I was actually in the UNAIDS target setting discussions that Chibwe just referred to. I think we can take the slide down, Savvy. I won't get into, I don't think we have enough time for discussion, but there is a slide with some considerations to share with colleagues when the slide set is shared. So I just want to make 3 quick points in the time remaining. First, I just can't thank Chibwe, Savvy, and Maria enough. It's really, our kind of pillar to do so much of our work. This data is so critical. And what I want to stress first is that this is really a partnership with DAPM. We work very closely as HIV program team globally with the data colleagues. We so appreciate and we need this data so much to inform our work. And I really want to encourage you, just the way we work together globally, that you also take this information, take this webinar and the dashboard, become familiar with the dashboard and take it to a dialogue in your own regional and country offices with your data colleagues. Let them know what we have in terms of HIV data, how we work, what the data are showing us, what we've seen in terms of decreased incidence and mortality, and what we need to see in terms of accelerating and sustaining the response. So I really encourage you to do that. And then when you start to unpack a bit, I also encourage you to identify where you see gaps and where you have more questions and feed those up to us. This is a discussion that, we're very much engaged with a number of partners led by UNAIDS, working closely with WHO, John Stover and the Spectrum team at the global level to clean up the data, to share and develop these dashboards. But we also really want to hear from you and what the implications are at country and what you hear from governments and partners. So please, let's continue that conversation and let's do it in partnership. The second point is really about our role in data vis-a-vis UNAIDS and the UN family. We are part of the joint program. We really work together as part of that joint program. What you see on info.aids is, it mirrors what you're seeing in the UNICEF data dashboard. And I strongly encourage you to go to the dashboard that Savvy has shared with you. Not only is it beautifully presented and extremely accessible, we were at the International AIDS Conference and we had people gathering around us in the coffee shop to have a look. because everyone was so excited in the way that it was presented, but it also really reflects the UNICEF focus and comparative advantage and what we need to do. So one, it's very clear on the UNICEF countries and regions, but the second is really zeroes in on the impact of HIV on children, pregnant women, adolescents, and starts to bring out data like the percentage of PMTCT clients who are adolescent girls and young women, the kind of information that is so critical to us to either shift or strengthen our programming on the ground, and the kind of information that we need to not only have the programmatic discussions to make sure that the programs evolve based on the evidence and the data, but also to use this data to inform discussions around resource allocations. When Global Fund comes to town, we should be at the table. We should be able to share these dashboards. I think people are going to be really, really excited about the way it's presented, and it's really going to help us to ensure that children and adolescents and pregnant women, that their needs are really part of the discussions. When there's a discussion in health on primary health care, when there's a discussion when Global Fund comes to town, or PEPFAR or CDC, please open up your computer and share and show what we have in terms of the data and what it's telling us, and start that conversation. And the last thing I want to say, we love that we can get the PDFs and download this data. Again, I encourage you to take some time to sort of go through and see what's useful and how you might use it. I really encourage you to look at those dashboards and the estimates, and think about the data, the right data for the right purpose. So what kind of messages are you going to pull from that data when you're in a broader meeting with the Ministry of Health and funders? And what kind of message do you want to pull when you have 30 minutes with your rep who doesn't know much about HIV, and it's not really appearing in your CPD discussions or in a discussion on the health strategy? Really think about how you can use it in the right place and the right time and with the right audience. When you have a deep dive with the joint AIDS team around the table, go into detail, ask for a slot. When you have a UNCT meeting on health, ask for 30 minutes to share this and present this with your data colleagues. I think, we are really seen by government as a key partner in the data space on HIV. And I think that you should, claim that space and you should really use this information as much as possible. It's so critical. We're really at a moment. Also, as we develop the new strategic plan of UNICEF, as we look at the health strategy refresh, it's really a moment to highlight what we're doing in HIV programmatically. But for me, we always say this in every forum we're part of, that our contributions and our engagement on data are really a critical aspect of UNICEF's Global AIDS program. So please run with it. We're so excited. We're so grateful to DAPM and the colleagues. And I know it's so much time and effort to review and contribute and clean that data and develop those icons and dashboards. And really, we're so grateful. So thank you so much. Back to you, Isabella. Thank you.
No, thank you. Thank you for helping us wrap up. Savvy just pasted the URLs to all the dashboards in the chat box. And once again, I'd like to remind everyone that we're going to be sharing the recording with all of you so that you can spread it among your networks. And I would like to thank Joanne and Savvy again for the amazing presentation, and everyone for coming and participating. Wish you all a great rest of your day.
Thank you.
Thank you.
Thanks, everybody.
Thanks,
Bye, everybody.
everyone.
Bye.
Thank you, everybody.
Bye.
Thank you. Bye-bye.
Thanks. Bye to all.